Now it's my pleasure to introduce to you the Associate Professor Corinna van den Heuvel and Dr. Kathy Gapford.
Thank you, Nicole. Before we get started, it's my honour to be able to officially acknowledge the Kaurna people who are the original custodians of the Adelaide Plains and the land on which the University of Adelaide campuses here at North Terrace, Waite, Theberton and Roseworthy are built. So we would very much like to thank all of you for giving up your Sunday morning to come and hear about these fantastic health and med sciences degree programs. I'm Corinna van den Heuvel.
And I'm Kathy Gapford.
And we tend to do a bit of a tag team presentation. If I forget things, Kathy jumps in and vice versa. So hopefully today we'll enlighten you on all the important points about these programs. And then at the end of our presentation, we'll have plenty of time for questions and also invite our students to come and answer some of your questions as well. So before we start about the health and medical sciences programs, it's really important to remind us about our faculty generally. So it's really exciting to say that I'm really delighted to report that the latest results from the 2017-18 ratings are brilliant news for our faculty, and we were first in health across all institutions in South Australia for teaching quality and first in health for overall student experience. So these results really reflect the high quality teaching and dedication of all of our staff in our undergraduate programs. Our students and graduates also win local, national and international awards with 14 Rhodes Scholars and 24 Rhodes Scholars, and 14 Fulbright Scholars. And really it is our aim within our faculty to make tomorrow's health professionals and our research leaders. We also have award-winning teachers and academics respected internationally for their work. We have numerous internationally renowned researchers who are successful in obtaining category or competitive grant funding, and an enthusiastic and motivated community of clinical title holders as well, and strong partnerships with the community, industry and government. So let's talk about the Bachelor of Health and Medical Sciences and the Bachelor of Health and Medical Sciences advanced programs. When you look at the actual structure of the degree, it really offers a very integrative and multidisciplinary approach to broader aspects of healthcare and research. And that word broad or generalist education for students who are really interested in human health and disease. So we often find that many of our students come into this program because they're interested in the human body and they're interested in what can go wrong with it, but they're not entirely sure exactly what aspect of health they want to go down or what direction or pathway they want to go down. So this program offers them all of those building blocks for them to be able to, really establish what aspect it is that they want to pursue. We focus on human health and healthy communities, and our aim is to really produce graduates who do have a desire and knowledge and skills to improve human health. So it does really produce a firm foundation for employment in a really broad and wide range of health-related areas. And we also offer many pathways to postgraduate study. Also in our degrees, we have a very strong emphasis in research, and as part of restructuring this program a couple of years ago, we really wanted our students to get their hands dirty, to actually get their hands in and meet their potential supervisors or potential employers. So one of the unique features about this program, which we'll talk about in a little while, is at third year, every single one of our students undertakes a full year research project. So this means you're out there, you're interacting in laboratories, in industries for a full year, and it really solidifies your area of specialisation. So if you choose that you want to do a major in neuroscience, for example, you're out in a neuroscience lab meeting with neuroscientists or in industry. Do you want to say something?
So at the end of the program, those of you who have finished the program will be able to map out what the work-ready skills that you're coming out with. We have a lot of training in communication. You'll learn to find information, to analyse information, to present information. And so as well as having that knowledge, the broad knowledge of health and then the more in-depth knowledge of the specialisation of your major, you'll come out with a set of skills that employers are really after in the graduates.
Absolutely. So the other thing in questions about why would you study health and medical sciences? Well, you learn about the human body. We aim to improve human health, work in a variety of health settings. There are numerous electives to complement your degree. We aim to get you work ready. We also provide opportunity to study overseas, so you can go and have on a global exchange program as well. Many different majors that focus on current relevant health issues. Also develop a broad range of skills and understanding of health. In the advanced degree, you also really aim to seek solutions to global health issues and to further collaborate with health professionals and industry partners. So in this program, there are 7 majors that students can choose from, and we've broadly classified them into 2 broad streams: medical health and lifespan health. And the key thing here is that we don't expect first-year students, or even second-year students for that matter, to know exactly which major they want to choose. You only really have to start working that out towards the end of second year. So if you keep your options open, you can actually choose courses to enable you to keep all of your options open for all 7 majors. It's only really at the end of second year when you have to really decide which of those 1 majors or areas of specialisation you really want to pursue. So first of all, in clinical trials. So if you're interested in working with patients to advance human health or clinical research, and because it's the process by which new therapies such as medications, biological agents and devices are tested with patients. So this major really allows you to acquire the expertise needed to design, develop and conduct clinical trials in hospitals, in research organisations, institutes and pharmaceutical companies. The next major is medical sciences, and this will enable students to understand how the human body functions in health and disease, and also how treatments for diseases are developed, and you'll gain an understanding of the fundamental medical sciences disciplines of anatomy, physiology and pathology. And the third major in this grouping is neurosciences. So if you're fascinated by the inner workings of the brain, then neurosciences is the major for you. It will equip you with an understanding of how the nervous system regulates the body and behaviour, with a view to finding ways to prevent or cure neurological diseases.
And if you're interested in neurosciences, you're going to be seeing a lot of Karina as
A
well.
lot of me. That's my personal favourite.
So within lifespan health, we have a major on addiction and mental health. So really looking at that interaction between how drugs and addiction change the brain, but also how the brain regulates addiction, and looking at the scientific basis of substance abuse and of mental health, and as well around interventions, so pharmacological interventions, behavioural interventions, public health interventions to deal with those issues. Our major in nutritional health is really for those people who are passionate about nutrition, diet and healthy lifestyle, and how that can promote good health, to consume the right diet and prevent diseases such as obesity, diabetes and cancer. So this major really looks at what good nutrition is, what that looks like, and how the body responds to the diet in terms of nutrient uptake and longer term changes. Public health major focuses takes a step back from the individual and starts to look at health from the perspective of the population. So promoting optimal health through both individual change but also at the level of the community. So the kinds of skills that graduates who specialise in this area will come out with is the capacity to measure health at the level of a population, to understand social, cultural and economic factors that are affecting health and how that contributes to contemporary health problems, and to look at health promotion and health education to really deal with health problems at that big picture level. And finally, within the reproductive and childhood health major, students will look at the problems around fertility, pregnancy and birth, and also look at health issues that relate to children and adolescents. So we've been having a lot of fun this year in the third year courses looking at childhood health and the biology of the health, but also looking at those. This is a really nice blended major that brings in the public health aspects as well to those questions. All right, Corinna, do you want to talk about the research
sure.
experience?
So again, I've already kind of touched on this, but one of the things that we are really excited about, and it's the first year this year that our third year students are out there doing these research placements, is the fact that each of you in third year actually immerse yourself for a quarter of your third year load undertaking these research placements. And you really get to choose exactly what research placement you want to do. And they vary, and I can't even remember the enormous list of them. So this year we've successfully placed over 100 students in their research placements. And the fantastic thing is that we had enough research placements offered by our affiliates, by our clinical title holders, by our academic staff to actually place over 240 students. So that just shows how eager our title holders and affiliates are to really get in and meet you all, and have you or host you and also mentor you for a year in this program. So the aim of this program is to really gain first-hand research experience, place you out in state-of-the-art research facilities and also within industry. So it's not all about being in a laboratory. It is also about being out in industries, such as Women's and Children's Hospital or the Cancer Council or the Heart Foundation. And also just give you a taste of a potential career path, and importantly to open doors for you. And this is really crucial because these people may actually become your PhD supervisors, or they may actually become your employers. So this is your opportunity to get to meet them and to create your networks, and also really to gain and apply those skills.
And even if you don't end up working with those people directly, you've now got a group of well-established leaders who are able to be your referees for other jobs because they know you, they've worked with you throughout a whole year. So you've got that real link into people who know what you are like, who've helped you develop work-ready skills.
And the other thing I want to stress too is that it's not only third year where you get to meet the clinical title holders or affiliates or the academic researchers. Even in first year, in your core courses in first year, there are tasks where you actually have to interview a health professional. So these people actually come in and teach you lectures or give you tutorials from your first week at uni, and then the relationship or their input really builds and gains momentum right up until third year. So some of the links we have with industry, we're really proud of these links, and this here is only a really small amount of them, including SA Health, National Heart Foundation, CMAX. This is just some of the places where our students end up doing their placement.
Yeah. And I think with all of those places are listed on that slide, we have students doing research placements in each of those this year.
Yeah, and so far it's too early to actually get official student evaluation from the research placements, but certainly, here are just some comments that I've been getting emails from our students. They are absolutely loving it. I've got 3 doing a project on traumatic brain injury, and I'm loving getting to know them, and they're really, really embracing getting into the laboratory and learning some skills. And one of them is already really keen to lock in an honours project with me next year. So this is really at the heart of why we have introduced these placements. So just a brief overview of what you can expect. I'll do the Bachelor of Health and Medical Sciences, and Kathy will do the advanced program. In first year, there is a core course called Create, Communicate and Connect. This course is a fabulous course because it does all of those 3 things.
I'm just going to fill them in on university speak.
Oh,
so
okay.
A core course means that everybody in the program does that course as part of the program.
Yes, you have to do it. It's core. So there is one of them at first year and there's one of them at second year. All the other courses are electives. So this core course, Create, Communicate and Connect, really gets you involved. It gets you meeting people, working in groups, solving problems. It teaches you how to read literature, how to cite literature, how to interview skills, how to create a LinkedIn profile. All of those things start really from in first year. And we know from surveying students that students will stay here at the university if they have a core group of close friends. And so getting you in groups and doing a lot of group work at first year absolutely helps that, and I'm sure our students can vouch for that as well, just to get you, get to know some familiar faces and study together, etc. In doing that, most students choose a couple of key courses that they know are going to be really important courses for second and third year, but then you still have an enormous amount of choice. There are 5 courses you can do in first year that are just elective courses, and they don't all have to come from within our faculty. So if you really love languages, or you love philosophy, or economics, or maths, that wasn't me.
I've had one in my program who wasn't happy unless she was doing high-level calculus, which we could accommodate, that was fine.
So you can choose courses from outside of the Faculty of Health and Medical Sciences. You're not stuck or locked in this faculty. At second year, the core course is called what we call RRR, because it's easier to pronounce, Reflect, Research, Resolve Questions in Health. And you still have enormous choice to do electives. Generally, by second year, though, what we find is students are starting to work out what major they're looking at doing, so they tend to do more electives from within our faculty, because they're going to clearly be much more relevant for their third year courses. So they don't tend to do courses outside of our faculty. Some still do. But generally they start looking within the faculty and doing courses like physiology or like anatomy or public health, because they're going to be the prerequisite or foundational courses needed for them to go on and do those courses at third year level. And at third year, 1/4 of your time is spent in the research placements. And one thing I want to stress about those research placements too is they're so broad, and there's research placements where you can just do it on your own, one student, particularly if you're out in industry, or there are groups of 2 to 4, and I think we even have some larger groups of up to 6 students. So again, when it comes time to choose your research placement, you get to nominate your top 10 preferences of what your research placements are that you'd like to do, linked to your major, so they have to be listed under your area of specialisation, and then we place you in those research placements. And I think this year, probably 90% of our students actually got their first preference of project, so which is a fantastic outcome. Have I said enough on that?
Yeah, I'll fill the rest
create,
in,
communicate
that's
and connect. I've already touched on this, so I won't spend too much time. So this is all about getting you transitioned into university. It can be really, really scary. You've come from a school where the teacher knows your name, which might send you reminders of overdue work, or you've got a day to submit an assignment. Yes, at university, we really do try to get to know every single one of your names, but when I'm staring out to an audience of 400 students, it takes a little time for me to get that. So it's a different world. It's a brilliant world, but it can be quite daunting. So this course is all about getting you transition successfully, giving you those foundational skills, and also getting you already thinking about careers. So it's all about life at the university, how to find and evaluate information, writing skills. It looks at academic dishonesty and what plagiarism is, teaches you really how to write appropriately, and also how to communicate effectively. And we know from our students that actually do go on and do honours or go out into the workforce, if you can communicate and you can interview well, then people want to employ you. It's as simple as that. And also building your networks, and all about professional conduct, how to write an appropriate email, just as an example. In second year, the RRR course, again, really gets you working in groups to solve relevant health issues. And in this course, you actually start getting exposed to some of our majors. So some of the topics they're talking about in second year this year, they're looking at childhood obesity, they're looking at binge drinking, they're looking at preeclampsia. So all of these topics in nutritional health, in reproductive and childhood health, and addiction and mental health are being tackled in this second year course. So what that does is it gives you a little bit of a taste as to what you can expect if you go on and do those majors at third year.
Okay. So you'll see that there's a lot of similarities between the Health and Medical Sciences and the Health and Medical Sciences Advanced program. The advanced program, we're really hoping that this program will lead to developing the next generation of leaders in health. So it's very broad. It's going to give you some in-depth skills in areas, quite wide-ranging areas, from clinical skills right through to research-related skills. Within the program, you have the opportunity to meet researchers, to visit employers and planning towards a research career. Some of the things that set this apart from the Health and Medical Sciences program is the opportunity to gain clinical skills and experience, and I'll talk about the first year course in a minute. To look at solving big health problems within a small group setting within our second year core course. And in the third year course, we really look at how you might take those solutions that you developed in second year perhaps and go out into the world and apply those to solving health problems. So, like Health and Medical Sciences, you have a lot of choice, which is a little bit scary for some people, but actually really gives you a lot of options. You don't have to make decisions straight away. You can keep all of your options open in first year. So our core course in first year is a clinical skills and simulation course. In second year, we have hacking health, which is that small group identifying problems and identifying solutions course. And in third year, within the advanced program, there is also a core course around innovation and entrepreneurship in health.
Adam is there.
So Adam's here. You want to wave, Adam? Adam is the course coordinator for clinical skills and simulation, which I think students are having a heap of fun in from everything that I keep hearing this year. And that's really around gaining some clinical skills around assessing and performing treatments and procedures in health, using both mannequins. We've got a beautiful clinical simulation suite upstairs, and also with real-world actors, and gaining an understanding of the health system and how different people within the health system will work together, because it's really about teamwork to solve problems, as well as gaining some of those practical skills in preparing information, communicating information. In second year in can't even speak correctly this morning. The second year core course is called Hacking Health. And this is really about identifying technologies and solutions to health problems. And it's the kind of areas that industry and government are really looking at the moment, to try and find some solutions to health problems that are now available through the new technologies that are being developed. So it brings the group together. You, as a student or as a small group in that course, you have the choice of looking at which health problem you're going to look at, identifying what solutions are already available, thinking outside the box, coming up with potential new solutions, and then thinking about how you would evaluate those solutions if you were to implement them. So how are you going to know if they work anyway? And then in our third year core course in entrepreneurship and innovation in health, you'll really start to map out, if you have a solution to a problem, how would you go about taking that into the real world? Where would you look for support for that problem? Where would you go for funding? How would you write a business case? How are you actually going to work out whether it's working, and really extend the skills that you've developed in the second year course? I think we've touched on a fair bit of this already. So you'll see within both programs that there's a huge range of courses that you can take. There are core courses which are unique, so only students in Health and Medical Sciences or Health and Medical Sciences Advanced can take those courses, and they're compulsory within each of the programs. But that's less than a quarter of your load. So you've got a lot of options for the other courses that you'll take. And I think we've covered most of the rest of what's on that slide.
Flexibility. Flexibility can be really scary for a lot of students initially. I know when we try and meet every single new commencing student in the program, and often they go, we love that this program is so flexible, but it's actually really scary, and what do all these codes mean? And we try, as well as with our team of fabulous student and program support officers, really try and explain to you the university jargon and the university language to get you up to speed really quickly. So rather than that flexibility being scary, we wanted you to get the most out of it. And yes, you will, I didn't realise I was on that page. We let you learn from the best teachers. We have award-winning, national and internationally award-winning teachers, and we all try to use engaging online content, lots of videos, flipped classrooms, patient case-based courses, small group discovery, and we also have these massive open online courses too. So if you're coming in, and biology isn't a prerequisite for these programs, I must stress, but it is always great to have biology, but if not, we also have developed a fabulous MOOC, or massive open online course on human biology, essential human biology, that was actually designed by academics from within our uni, and Mario Ricci particularly, who is the coordinator of our first year human biology course. And we always say to students, enrol in that course as a precursor before you get started, so that actually really gives you some of those foundational knowledge that you may not have. Do you want to talk about this one?
Sure. One of the really nice things about this program is that in the redesign, we've made it work so that you have the opportunity to take an overseas experience. So there are courses that are taught from within this faculty where students spend time in New Zealand, in China or in the Netherlands, study courses, but you also have the opportunity through partner universities and through identifying courses in other universities that are complementary and provide complementary knowledge to go and spend a semester over abroad and study there and get credit for it within the program here. So a lot of students, usually that works out best in the second half of second year, when you've kind of worked out the area you're interested in, and you might, for example, go and do a physiology course in Pennsylvania, and you will be able to get credit for that against second year physiology here, so that you don't necessarily lose time by doing it. And everyone says that's an absolutely fantastic thing that they've done and one of the highlights of their program.
Absolutely. And I've already mentioned this, but you are not alone. You know, we have incredible degree support, individualised study planning for every single student. We often give everything you need to know about the program at enrolment time so that all your questions can be answered. We have program advisors down over in the Helen Mayo building who you can drop in and see them at any time. You can make bookings to see them. They are just fantastic, and we work really closely with them. So if there's a really tricky situation, or you have done previous study, for example, and we can arrange and assess for academic credit, we can give you real advice about taking time off if you need to, a leave of absence, all of those things. And we also have fantastic peer academic support program for first years. And we have a great Adelaide Health and Medical Sciences Student Society who, again, are there really to listen to any concerns you have, not just organising parties and balls and barbecues and things.
They do that pretty well too.
They do that pretty well, but they're also the intermediary between the students and us. So when we hold our monthly programs boards, where we look at the whole strategic we look strategically at the program and the direction of the program and review the courses, our students sit on that board with us and also just let us know if there's any issues or if there's some concerns the student have. And it's not always negative, it's also coming with really fantastic positive ideas or positive feedback as well. So we really listen to them. We feel it's really crucial that the students have a voice. So where do our students go? Do you want to do this one?
Give me the tricky one, right? No. So health and medical sciences students, we have our first group coming through third year at the moment. So we can't tell you where health and medical sciences and health and medical science advanced students go yet, because they haven't finished till the end of this year. What we can tell you is that within health sciences, which was the precursor program, about a third of our students would go directly into the workforce in a huge range of options within health. About a third of our students will go on and do an honours year, either because they're thinking about a research specialisation or to get some more experience and make themselves more competitive. And about a third of our students use this as a stepping stone into a postgraduate program such as medicine or physiotherapy or dietetics or education. And again, a very, very broad range.
Yeah, I think it's important. And we always get asked, where can this program take us? And it's a very difficult question to answer, because we have students who are out as health policy advisors, as nutritionists, as medical sciences, as health planners, as foreign aid workers, as clinical trials people at CMAX. It's so diverse, which is absolutely fabulous. But I think if you think of it in those three streams, is probably the best way to go. Students.
Now you've got to come and sit on the red chairs.
I'd like to introduce you to a second year student, Meg, and a first year student, Lewis. They haven't been paid or bribed to do this either, I'd just like to add. So I'm just going to ask a really, really vague, open-ended question, and then we will ask you guys if you have any questions. Is that what we're doing? Yeah. To ask us or to ask the students. So Meg, can I ask you firstly why you chose to do Bachelor of Health and Med Science Advanced?
Well, I chose it.
Oh, microphone. Sorry, you need a microphone.
I chose it because I wasn't exactly sure what I want to do in health, and I'm still not sure. But it gives a really good overview of anatomy and physiology, which I'm really interested in.
Fabulous. So what are you most enjoying at second year at the moment?
There's a couple of courses like specialising in physiology and case-based studies, which I really enjoy.
Fabulous. Thanks, Meg. Lewis,
first year.
Lewis, do you want to answer those questions too?
Sure. So when I was in Year 12 last year, I wanted to do medicine, but I wasn't entirely sure. So I sat the UMA, I didn't really study for it, and didn't do particularly well. And then I finished Year 12. I got pretty good results, so I decided that I wanted to see if I really wanted to do medicine, I would do this course rather than just sitting and taking a gap year and doing nothing. So I'm doing this course, and I love it, so I'm going to try get into medicine and transfer next year. And that's what I'm enjoying most. Clinical skills with Adam is fantastic. The opportunities to do CPR, vital signs are awesome, and the simulation lab on level 2 is incredible. Also human biology, you do it's called a laboratory session, and you're in the Helen Mayo building, the Ray Luft laboratory, and you get to look at people that have donated their bodies to science, and that's an incredible privilege and very humbling experience.
Yes.
And also, I met 2 of my best friends doing this course, which has been awesome as well.
Excellent. Thank you. So does anyone have any questions for either our 2 students or for Kathy and I? We're happy to answer anything.
You have questions?
Don't be shy. Not Adam. Can't answer a question. Yes. Do we need the microphone?
It should be alright.
Yeah, and then you just repeat.
Okay.
So this is kind of for Adam, but so when you didn't do very well in the UMAT,
Yeah.
which is fine, everyone practices a lot, probably me, but and you're thinking of going to med, would you ever think of staying in medical sciences and doing a career in that, or are you like super into?
That's a good question. Well, if I don't get in this year, I'll probably finish the course and then try to do postgrad. But I just love the human body and everything like that, so I wouldn't mind if I just became a health professional in some other field, but medicine is my
Are
main.
you like happy with your decision to not take a gap year and go into this?
Yeah, extremely happy. Yeah.
And a lot of people, like a lot of my friends I've found that
Just hold it up a little bit.
were like dead set of going into medicine, and then did this course and decided that maybe medicine wasn't for them, or decided that they want to finish this and then do postgrad medicine as well.
Yeah. Thanks. Anybody else? Yes?
If you pick a major and then sort of turns out you're not really liking it, are you able to change?
Yeah, that's pretty easy. Sorry. So with
You're
first
not
year
there
we
yet,
can
so don't worry.
with first year we can set you up with a study plan that leaves all 7 options open, because you guys haven't done things like addiction and mental health or been exposed to some of those things in school and public health, and you might decide that that's your passion, that hey, actually I don't just want to solve the medical problems of one person at a time, I actually want to look at a population level. So you can keep all your options open at first year. At second year, you probably can't keep all 7 options, but you can certainly keep 3 or 4 open quite easily if you're still not sure. Like some people they come in and they go, I'm going to be a neuroscientist, and that's what they head to from the word doc, but then they might get to the end of first year and go, actually, I hated the first year neuroscience course, that I want to do something else, and yeah, it's really easy to swap around.
On that too, many of our research placements actually cover more than just one major. So if you're really interested in neuroscience, but you also think, oh, but hang on, I want to do a clinical trials major, you can do a clinical trials research placement that may be testing a neurological drug. So there's lots of overlap. So you'll find that when you come to choose your placement, there is such a huge depth of choice for your major that, you can choose the right course program for you.
We're finding at third year that people too, because you've got your research placement and then your 4 courses of theory courses within your major, you've got those 2 other elective slots. So people will fill that in. So someone who's interested in nutrition during pregnancy might be doing a reproductive health major, but do their elective courses from nutrition.
Do you have a question? Yeah.
Yeah, so just with the clinical sciences course and the advanced, when you're nominating for your uni courses and you're nominating for the advanced, what's kind of the difference in the scores that you need to achieve?
Okay. So the question was about the different, what are the different entry requirements for the health and medical sciences and health and medical sciences advanced. Within the advanced program, you need an ATAR of 95 to get into the advanced program, and you need to maintain a credit average to stay in the program.
But if you don't have an ATAR of 95 and you start in the Bachelor of Health Sciences, if you maintain a GPA of...
It's 5.5, so halfway between credit and distinction.
5.5, then you can transfer into the Bachelor of Health and Medical Sciences Advanced. So transferring internally is quite easy.
So what was the entry requirement to the Bachelor of Health and Medical Science?
What was it this year? Do you know?
It was 70.25 for this year, so that's what you'd be aiming for next year. Just a note too that we have what we call an Adelaide approved score. So for the Bachelor of Health and Medical Sciences, if you received an ATAR of 80 or above and you had the Bachelor of Health and Medical Sciences as your number 1 preference on your SATAC application, then you'd be guaranteed entry. Okay.
Any other questions? Yeah.
I was wondering if there's any disadvantages to doing health and medical science and then doing medicine as a postgrad instead of starting with medicine and going all the way through.
So the question was around whether there were disadvantages into starting this program and then going to postgrad. Lewis, you might be one of the best people to answer that one.
I think there definitely could be. The first one is if you get into the undergrad, then that's like you're guaranteed that you're doing medicine, whereas postgrad there's a little like the GAMSAT's 6 hours. There's a massive essay component, and it's more like physics, biology, chemistry, like university level, whereas the UMAT's all skills that you can't learn. But I don't think it matters too much. I think, I'm not entirely sure, but is Adelaide bringing you postgrad soon?
No, we're not going to go there yet. But can I ask you that if you stayed in this program and then did postgraduate medicine, do you see that would be, extremely beneficial for you, or what you're learning in this program to then take that into postgrad med?
Yeah, I think that there'll definitely be. It's like, because I know from people that are doing medicine, some of my friends, some of the cool things they're doing is exactly what we're doing in human biology and the clinical skills and simulation. So, yeah, definitely.
Yeah, so the knowledge that you're getting from the courses within this program are still going to be relevant for medicine. I guess one of the short answers to the question about whether undergraduate or postgraduate medicine is if you do a program like this and then do postgraduate medicine, it'll take you a little bit longer to get there. But if you didn't get straight into an undergraduate medicine program, given that there's a finite number of places, this gives you those options at the end of this program.
A lot of the teachers that teach into health medical science advanced and health medical science also teach medicine. Like a lot of my lecturers will be like, I'm doing the same thing to the medical students at the moment.
I would love all my medical students to have an undergraduate.
Thanks, Simon. Any other questions? No? You can come and see us after if you have any more.
Okay, as Corinna mentioned, if you do have any other questions that you don't feel comfortable to ask in this forum, you're welcome to chat to them briefly afterwards. So I just wanted to talk a little bit about student support for, as Corinna mentioned earlier, starting universities can be quite daunting. So we have lots of support options available, and I just wanted to mention a few of those. For our Indigenous students, we do have a dedicated Indigenous health unit called the Yaitja Paruna Indigenous Health Unit, and we're very lucky to have dedicated student support officers that will help Indigenous students from inquiry right through to enrolment and all throughout your program. We're one of the only faculties that has that specifically for our Indigenous students, so we're very lucky to have that. And as part of the Yaitja Indigenous Health Unit, we also have a it's Health and Medical Sciences Scholarship, and that is we support 5 commencing Aboriginal and Torres Strait Islander students in their program for the length of their program, and it's up to $10,000 per year. So if you were studying the Bachelor of Health and Medical Sciences, which is 3 years, you'd receive up to $10,000 per year for support. So please, if you do come into the program, make sure that you align yourself with both the health unit and consider the scholarship as well. One of the big things that we have is our peer mentoring program, and this is a really important program in helping you in the transition from high school to university. As has been mentioned, it can be quite daunting. You won't have a teacher saying, don't forget that your assignment's due. They won't be reminding you for your permission slips. They won't be doing any of those things. It's very much about you being an adult and learning to be self-managed, really. But this program helps you navigate the sort of initial stages of university, which can be quite daunting. So with this program, you can actually choose a mentor. You might choose one who's in the same course as you. You might choose one who's in a different course or has some social things that you also are keen on doing. You can actually align yourself with a mentor online or face-to-face as well. So they would meet quite regularly, either online or face-to-face. These are all senior year students who have been in your shoes a couple of years before, so they know exactly how you're feeling, they know exactly the nerves that you're feeling, and they'll give you the insider tips that we aren't able to give you. So wherever you end up, please make sure that you consider a program like this, because I think it's really valuable to help you just settle into university and understand what's expected of you as a university student. Okay, so if we don't have any more questions, I'd like to thank you all for attending today, and we hope to see many of you here as new students next year or in the future. So thank you everyone. Thank you to our Facebook Live viewers.